Victorian financial advisor.
Yo, so we at 30 seconds, y'all. I'm holding this scene right quick. I'm jump to one scene and then come back to this scene. And we'll be in the show. I'm jump to this scene. Mel, we're up and running.
Yeah.
Let's go.
Hi, Be Health Empowered family. Welcome back to another week of Excuse Me, Doctor. I am your host, Dr. Melissa Clarke. Please call me Dr. Mel. And we are here every Monday evening to bring you health topics that are based on science. So you can be confident and empowered to make the decisions for yourself, your family, and community that lead to your best possible health. We focus on speculation. We bring focus, to speculation. We clear up misinformation and we debunk disinformation. And so I'm welcoming everyone who is joining us for the first time, whatever platform you're joining us on. Thanks so much for being here. To my newbies, if you're on Facebook, please make sure that you hit like. And if you're on YouTube, please make sure you hit that red subscribe button. Now, I know many of you have tuned in for the wonderful show that we have in store for you tonight. This is really timely because many young people are headed off to college right now. They might just be moving out of the house. But whatever it is, it's a rite of passage where they're gaining more independence. But with freedom comes responsibility, the responsibility for your own health. Mom, dad, grandmom are not going to be looking over your shoulder anymore. And these are especially challenging times when we talk about health, facing double and triple pandemics, COVID with the new Delta variant, mental health issues, the uptick in violence and just anxiety in general in life. And so, no one's going to be there to give you the traditional advice that you might have been getting. So we're going to talk about that tonight with some wonderful guests. For those young people who are focused on their health, for their parents who are wondering, what should I be preparing my children for health-wise as they head off to college? Everyone in my audience, please share with all those folks that you think will benefit from hearing this tonight. So again, thanks for tuning in. And as always, I can't do this without my wonderful co-producers. I'd love to bring them on with me right now. Miss Lila Mays coming in from California, and Mr. Wayne Bruce coming in from the East Coast.
Hey,
Welcome to you both.
Hey.
Hi, Dr. Mel.
What's going on?
Hey.
That was close.
Oh, a little bit.
That was close. I was scrambling for
producer talk.
Well, good. I'm glad y'all made it on. And we have a lot to talk about this week, so just let's hop right on into it.
Let's get to it. Here we go. The weekly recap.
Yes. the weekly recap. You know, we always start off with the numbers.
Mhm.
We are over 35 million folks who've had COVID-19.
Ay, ay, ay.
And basically, all 50 states are surging due to the Delta variant. And cases are up 70%. We're having about 32,000 cases a day. But that's probably an underestimate because lots of people who are positive for COVID probably aren't getting tested
Right.
either because they have no symptoms, right?
Right.
Or,
Yeah.
you know, they've been vaccinated and they have no symptoms.
Mhm.
Mhm.
So that's probably an underestimate.
So we're in the blame game now.
Well, how do you mean?
We're in the blame game. So you have no symptoms, and who's giving it to whom now, basically.
Well,
Vax
I mean,
unvax.
I think, you know, there's a question. A lot of places are bringing back mask mandates, even in the face of people who are being vaccinated because of how contagious the Delta variant is. So
Mhm.
even people who have been vaccinated might still be able to pass it on, even much less so than people who are not vaccinated. But everybody has to be really careful. And we're seeing that this surge is leading to a 36% increase in hospitalizations. We're seeing
Mhm.
pockets across the country where they're running out of ICU beds.
Yep.
A post went viral. Did y'all see that post from that doctor in Alabama?
Yes.
Yeah. Yeah.
Yeah. That was
Who people were begging her for the vaccine, Dr. Mel? Is that who you're talking about?
Right,
And
exactly.
she's like, it's too late. I have
too
to
late.
intubate you. This
Wow.
is
Right.
we too
And that
late now.
the vaccine is not a cure. It is something
It's
you
not a
take ahead
cure.
of time to
Right.
prevent yourself from getting COVID if you're exposed to it.
Mhm.
Mhm.
So yeah, that was really, it went viral and for good reason because she made some excellent points in it. Um, and then, you know, we're over 626,000 deaths from COVID. 97% of those deaths are among individuals who are unvaccinated and I just
Unvaccinated. I mean, I think
Can
that's
unvaccinated
hugely
folks.
can
important.
you just say that? Lean into the mic and say that.
Sorry, Dr. Mel.
97%.
We're
Yeah.
not laughing at the deaths.
Unvaccinated.
We're
No,
not
no, no,
laughing
no,
at
we're
it.
No,
not.
We're just
And
laughing at
you know,
no.
it's the thing, and I when we're preparing for this show, I was saying there's been a story circulating about a young man named Stephen Harmon who was only 34 years old, but had really been very, very vocal about not vaxxing. And one of his tweets that has just gone off the rails and is not funny at all, but one of his tweets was, "I got 99 problems and a vaccine one." And then
Wow.
he daily documented his experience with COVID and ultimately his demise. He left us last week as a result
Wow.
of COVID-19. But he was so adamant. People keep talking about he's a Hillsong member, he was a Hillsong church member, which is neither here nor there.
Wow.
Um,
Yeah,
however,
but that's, you know, sad. I always say that God gave us medicine and God gave us
mhm,
certain breakthroughs in medicine. None of this could happen without God, right?
right.
Right.
And unfortunately, I think sometimes people see it as a dichotomy. Like
Yeah,
I believe in God or I trust science. And
science.
there to me is really no dichotomy. That it's all one. And
Yeah.
God works through different ways. And unfortunately, sometimes that comes into people's decision making process in a way that influences them away from taking advantage of what God has put in their path to help them, right?
Mhm,
Um,
mhm.
so I feel when you told me about that story, it was terrible, but I believe he was African American. Is that right?
He was 34 years old, African American gentleman, yeah.
So it kind of underscores two things. One, what I'm hearing from my colleagues in the emergency department and the ICUs, that those folks who are coming in with COVID are younger and younger and younger. And
Mhm.
it's people 20 to 40 who are actually getting COVID and dying now because of this Delta variant. But
Mhm.
also, this study came out this week that Black people in the highest income level, right,
Mhm.
had a
Yeah.
3 times higher death rate than whites in the lowest income level. Now, money doesn't solve problems, and that's not the point. The point is that people always say, "Oh, well, people have worse health outcomes because they're poor." Well, that's not the case here.
Wow.
Black people, even Black people with money, are still having the same issues with higher rates of dying from COVID. So then, all Black people basically are having a hard time of it, regardless of your income level, your education level, whatever you think might be protective is not. And that's very concerning. And I definitely wanted to highlight that and point it out.
Yeah.
Yeah.
Go ahead, Wayne. What were you gonna say?
No, you guys are still talking about the Hillsong thing. That's really, shocking and
It
Yes,
is.
that's
May
it's
he
just
rest in
very,
peace.
very sad. It's very
Very.
sad. And yes, may he
Right.
rest in peace and condolences to his family.
right.
Absolutely.
It's so sad. But okay, so he was adamantly against the vaccine. So, doctor, in that vein, let's get into some facts.
Well, we have gotten to a tipping point. Over half the country, 57.2% of the eligible United States population, so those over 12, are now vaccinated. So more than half the country, we finally passed that halfway mark.
Okay.
However, at the current pace, we're not going to get to 70% until December.
Wow.
So that's somewhat concerning.
So
Y'all make me sick. I'm
that-
sorry. This
I gotta
is
jump
my
in.
view. This is not the view of the doctor, but go ahead.
It's the view of some doctor. Look, the shocking fact for me this week was I found out that 96% of doctors are vaccinated.
Right.
Yeah. And it's not like it's some kind of secret that we're keeping to ourselves. We're trying to get everybody else to jump on board.
But
and
can I ask, what's up with the 4%?
The 4%, right? That's the number that sticks for me is the 4%.
What is
right.
up?
Well, yeah. So some of those individuals might not be able to be vaccinated. Maybe they've had severe allergic reactions to the contents of the vaccine. Some, doctors still have their own religious beliefs. Some may have religious objections. I mean, there could be any number of reasons for that 4%, but 96% are living that vax life, and I'm one of them.
we appreciate you, Dr. Mill, so much.
Let's vax it up.
And I hope other people join me in that vax life.
Right.
I really do. I actually was invited to a party that's like, if you're vaxxed, if you're vaxxed, you got the invitation. If you aren't, oh well,
be mad at me.
Yeah.
Be mad at me. So
look, we have a lot of other things to talk about.
We do.
Yeah.
We do. Let's get to one of my favorite subjects, food. So look, I gotta laugh because our viewers are very funny, and I'm just reading the comments, and we have a comedian who happens to be a singer who watches us sometimes. His name is Will Downey. He said Dr. Pepper was one of the 4% that didn't get.
Yeah.
You can't stop these people.
Thank you, Mr. Will Downing.
Thank you, Will,
for those insights.
Just can't do it. So look, let's get to one of my favorite subjects, food. I'm just saying, but I don't eat a lot of red meat, and we're finding out, it's good that I don't eat a lot of red meat. Actually, I don't eat any red meat unless I'm in Jakarta.
Well, actually, you do eat lamb.
Okay.
I'm just saying, and it showed that in this study that came out. It was a study of over 1.4 million people. They followed them for 30 years. And so this is like a analysis of multiple different studies. It showed that eating beef, lamb, and pork, as well as processed meats like bacon and sausage, I know this is a downer for a lot of people, will significantly increase your risk of heart disease. It's like 9 to 18% per 2 ounces of meat eaten a week. So there was no issue with poultry. So the chicken and turkey lovers out there, That's not contributing to worse heart health. And that's because there's lower levels of saturated fat and lower levels of sodium with the chicken and poultry. So what does this mean? Well, if you're not able to quit red and processed meats altogether, you want to limit your amount to about 3 ounces per meal. That's the size of a bar of soap. Green should occupy the majority of your plate. And you should have at least one meatless meal a day and ideally one meatless day a week, just to cut down.
Okay.
Yeah. I mean, I think that's achievable for most people as a start.
I mean, that's great. I mean, one vegetable meal a week is cool. Long as we can't.
No. One meatless meal a day and one meatless day a week.
One meatless day.
A whole day.
You had some of that good old carrot bacon that the vegans are making
Carrot
these days.
bacon? Is there such a thing?
Yeah, I saw something about that.
There's such a thing as carrot bacon.
Yeah,
Yes.
but you can also have beans. That's an alternative, tofu. I mean, and if you can't do a whole red meatless day, you could do fish.
Yeah.
So
Okay.
it's doable.
Yeah. Fish bacon is not the same. I'm just saying. Salmon bacon.
Okay.
I am not
Moving
that.
on.
Moving on.
Speaking of food.
Speaking
Did
of
y'all
food.
set y'all babies up for a healthy life by breastfeeding? My mama didn't. My mama didn't set me
Well-
up for a healthy life, Dr. Bell. I don't think
So
she
I
did.
assume that means that your mom didn't breastfeed you, because
Didn't
this is all
breastfeed.
about the fact that if you breastfeed a child, a baby, for any amount of time, it turns out that these 2,400 toddlers that they looked at had lower blood pressure than those who were not breastfed at all. And the differences were seen as early as 3 years of age, indicating that breastfeeding really can help to sort of set you up metabolically for a healthy blood pressure for the rest of your life. So, and it turns out that breastfed children had lower blood pressure regardless of the amount of time spent breastfeeding.
Wow. Okay.
So
That's really that's a very, very interesting statistic. All right,
Yeah.
moving along. Did y'all know hospitals might have to start showing their prices?
Uh-oh.
yeah.
Is it like a menu, Dr. Mel?
Is it like Walmart?
Well, yeah. I mean, you can actually pick and choose based upon the hospital prices that are displayed, which hospital you want to. A lot of us have high deductible health plans, which means
Right.
we have to go through like $2,000 or $3,000 of our own money before the insurance company will kick in their part. So if you're getting a procedure done or you're getting a service done, you're going to want to know, well, what does hospital A charge versus what does hospital B charge? You also want to know the quality of those hospitals too. So that's important. You don't want to necessarily just go for the lowest one. And you can find that out at medicare.gov in terms of the quality of the hospitals. But it turns out that even though this is now a federal requirement, not all hospitals are on board yet. Only one. They looked at hospitals in Georgia. Only 1 out of 14 are doing it. But I think you'll see in the future coming up that this will be an option for you. And also the thing that you should know too is that hospitals negotiate their prices with insurance companies. So they charge the insurance company less than what they charge you if you're paying out of pocket. So if you're able to see those prices, you actually might be able to negotiate down if you're paying out of pocket.
Right.
Awesome.
And
I agree.
So
one of our viewers said that would be great for them to show prices, because paying $25 for aspirin is ridiculous.
Yes, it is. Absolutely.
We agree with you, Cheryl. So that's great. I mean, but let's go to, sometimes I could be a little OCD in my refrigerator with, with expiration dates.
Very OCD.
And I throw out everything. I've been known to throw out everything in my cabinet if it looks to be. If it's close, if I can't read the date on it. So you now saying the expired food labels are a lie?
Yes. Researchers have found that those expiration dates really don't correspond to food actually expiring or spoiling. They're not standardized, and a lot of times those dates have nothing to do with food safety. So you might see a best buy label on one product, a sell by, a best if used by label before. They all have different meanings, but they really don't equate with food safety. And the problem is it's causing a massive amount of food wastage. 40% of food produced in the United States ends up in the landfill for this very reason. So keep this in mind. Most packaged foods are perfectly fine for weeks or months after the expiration date. Canned and frozen goods last for years. The package of chips that you forgot about under your car seat that's a month out of date is not going to kill you. They might be a little less crunchy than what you thought. Now, the big exception is food like deli meats, which we found out we're not supposed to be eating anyway, and deli salads, which, you shouldn't reheat or obviously leave out of the refrigerator because they will spoil. But, again, milk, properly pasteurized milk should be fine if it tastes and, importantly, smells fine. So keep those things in mind. It'll probably save you a whole lot on your food bill.
So 2 things in that, Dr. Mel. That does not include the French fries that fell in between your car seat.
Yeah, no, I wouldn't mess with those.
Don't mess with those because they're not good. Yeah. And then someone actually had a question while we're on this, and it's a real important question. This is not, does medicine expire at the same time as stated on the bottle? So that's really relevant.
So I would go by those expiration dates. I'm only talking about food right now.
Okay.
And the best thing to do is ask your pharmacist.
There you go. So you know what's next. We're finished with the debunk.
Yeah.
Here we go.
We finished with the recap. Here we go.
Debunk. Stopping misinformation in this tracks.
I heard that 82% of women vaccinated with the COVID vaccine had a miscarriage. It was in that journal. I told you I'm not getting that shot, and I'm not giving it to my teen daughters either. I want grandbabies one day.
I don't know about that. Excuse me, Dr. Mel, is that true?
That is absolutely not true. It's actually a viral social media post that's been going around, but it's totally based on fake number crunching. So this is a deal. There's a lot of math in this debunk. So I apologize ahead of time, but this is a deal. So they looked at about 4,000 women in the vaccine, the VSafe database, who were vaccinated at various times during their pregnancy. They only got data back on about 127 of them so far, right? Because pregnancy is a 9-month process. So far, about 827 of them have reported. So of those 827, 712 had live births, all went well. And those were women who were vaccinated after their first trimester because, it takes 9 months to have a live birth. And so they got vaccinated after 20 weeks. 104 of them miscarried before 20 weeks. So this is out of the 827. So 712 live births, 104 miscarriages. So the authors of this study reported a miscarriage rate of about 12%. That's 104 out of 827 before 20 weeks. Well, a regular miscarriage rate, just in normal everyday living without vaccination, is somewhere between 10 and 20%. So this is well within the range, okay? But this is where the confusion comes in. This is where, the grain of truth gets distorted. The critics of this study said that you should not consider women who could not have miscarried before 20 weeks. So the 712 people who had live births, they're saying should not have been included in the calculation. So you got to minus the 712 from the 827. That leaves 126 women, right? So they're saying those 126 women who were vaccinated before 20 weeks, if 104 of those had miscarriages, that's an 82% miscarriage rate. Okay. So the math is correct, but this is the issue. they're being very manipulative, because really the entire number of people in the study, remember I said it was 4,000 that they looked at, only 827 have reported. Of the 4,000, there were actually 1,224 women who were vaccinated before 20 weeks. So therefore, the 104 miscarriages before 20 weeks were really out of a total of 1,224 people, which then translates to a miscarriage rate of 8.5%. It's actually lower than what the people in the study reported. So, and again, that 8.5 rate is lower than the average miscarriage rate of 10 to 20%. Now, we don't know, not everybody has reported yet in the original study of those 1,224 women who were vaccinated before 20 weeks. So we don't know. We can't really say that it's really just 8.5%, but we can assume that no news is good news and that they're continuing on with their pregnancies and as expected. And when their pregnancy, gets to its final conclusion, then we'll hear from them. So the bottom line is the 82% is a lie. The numbers are within the normal number of miscarriages that women experience, regardless of their vaccination status. And the study is not yet complete because all the pregnancies are not yet finalized. So that is the debunk for the week. So far, from other sources of data that we know, the 75,000 women that are in the other database who've been vaccinated, the VAERS database, again, they've already looked at it and seen that there's no change in the rate of miscarriages, and that all the things that we hear about the vaccine affecting fertility have not panned out. It's just not true.
All righty. And there
So-
you have it.
I'm that meme right now with all the calculations.
I apologize
you,
ahead of
Dr.
time, but I wanted to exactly
You did.
why that 82% was just way off base.
Yeah,
Okay.
it's just the numbers are wrong. Okay.
The numbers are wrong.
Right.
Bottom
And there
line.
we have it.
So thank you to Lila and Wayne for taking us through the recap and the debunk this week. I will see you all in a little bit. And we are now going to go into our show. As an emergency physician, I've worked at hospitals that are associated with college campuses, not once, not twice, but actually 3 times in my career. And I can attest, and that's at George Washington, Georgetown, and Howard University. I can attest to the fact that there are unanticipated health challenges that some young people who are headed off to college will face. Now, they can be prepared for, but it's important that they're not going to have the close supervision that they're used to. And it's a time of life known for experimentation and risk taking. There's anxiety about achievement, anxiety about peers. There's the possibility of depression from being away from those things that are familiar. There's easy access to alcohol and certain drugs. And all this is amidst the possibility that they may have health conditions that they have to manage on their own for the first time. Diabetes, asthma, food allergies, etc. So tonight, we are going to give advice to newly independent young people who are headed off to college about how to take charge of their health and healthcare. And we have 3 really knowledgeable guests that I'm really delighted to welcome. The first is Dr. Nicole Rochester. She's a board-certified pediatrician, health equity champion and consultant, professional health advocate, TEDx and keynote speaker, and the CDO of Your GPS Doctor LLC that helps aging individuals, those with chronic illness, and family caregivers to navigate the healthcare system. You can catch her on YouTube, on her show Navigator Nuggets, and other social media platforms. And she herself is the mother of college student. Welcome, Dr. Rochester.
Thank you so much, Dr. Mel. I'm really excited to be here.
We are excited to have you. And joining you, we have 2 other wonderful guests. Miss Nia Anderson, who is a rising college senior at Howard University. She's a political science major who, over the pandemic, became more in touch with the healthcare industry by working at a COVID testing site. She's also developed a passion for addressing and exploring mental health issues within the African American community. And she is also my niece. Welcome, Ms. Nia Anderson. And next to her, we have Mr. Max Anderson, who is a historian, teacher, finance professional, but most notably here, he is a father of 3 college students, one of whom is Nia. The other is a rising sophomore it will be her first time away from home because of COVID. She missed her freshman year, and her youngest sister, who is going to be a college freshman. So welcome to both of you. Thanks so much for joining. So we are going to jump right into it. So Dr. Rochester, I mentioned that you're CEO of Your Doc GPS. Can you tell us what that is?
Yes, it's Your GPS Doc. And Your GPS Doc is a health advocacy company. And the mission of my company is to help patients and their family caregivers understand and navigate the healthcare system. I'm a former caregiver to my late father, and that's the reason that I left a full-time career in clinical medicine after caring for him and seeing firsthand how complicated the healthcare system is. As you mentioned, I'm also the mother of a senior. And when she went off to college, I started reflecting on all the mistakes I made with my oldest daughter when she went away and how unprepared she was to manage her own health, despite her mom being a pediatrician. So I was determined to get it better and to do better the second time around. And so we have a college health division affiliated with Your GPS Doc, where we help college students and parents understand the healthcare system as well.
Wonderful. So I want to go to Nia first, to Max first. So as a veteran parent of college children, we just heard from Dr. Rochester saying, she knows what she might not have done with her first child, what she's doing with her second child. How did you and your wife prepare your children for the new college environment that's going on with COVID right now, with so much to think about?
Well, what we tried to do is to emphasize the importance of wearing your mask. All 3 of my children have had the vaccine, and we emphasize the importance of definitely having that. But we also understand that the Delta is still a part of the situation that we're in, and so we also need to be aware that the mask is very important. And so we've emphasized for them to also take in consideration the fact that this pandemic is still going on. It has not ended. You do have your protections, but you also still need to take the precautions and be cognizant of the fact that there are still COVID still out there, and to protect yourself. So if you're at a restaurant, try to make sure that you stay 6 feet away, keep your mask on. Also, create to a limit in terms of places that you might venture to that have a lot of people, and also just to take the precautions that you have and to understand that this pandemic is not over and you need to still protect yourself even though you have been vaccinated.
Well, absolutely. All wonderful advice. And, I've understood that about 10% of colleges are requiring vaccines to return to campus. What do you think about that decision, Dr. Rochester, in terms of whether colleges should be requiring vaccines to return?
Well, as a pediatrician and a college mom, I fully support that decision. I think all of them should mandate vaccinations. I know that there was a recent lawsuit with Indiana University, which they won. But some of the students sued the university and said, because of their rights, they should be allowed to make that decision. But we are in a global pandemic, and you all already reviewed the numbers that, as you mentioned, are continuing to rise as a result of the variant. And, with the other things that you mentioned in terms of college students, we know that, they're brilliant, but their brains are still developing. They are prone to risk-taking behavior, and it's just not safe. I mean, we saw what happened when the pandemic broke out. and the numbers that prompted these colleges to close in the first place. So really the only way that we can keep our college students, as well as the staff and the faculty, safe is to require vaccination for those who are able to do so. So I fully support 100%.
Right. And I love that point that you made, that actually your brain doesn't stop developing in terms of executive function and decision making until you're 25. And so that college age, sometimes individuals don't think through all the consequences, not necessarily because they're irresponsible, because their biology actually isn't even really there yet. So speaking of that, Nia, I wanted to bring you into the conversation. We've touched on COVID, and we're going to get back to that. But since we're talking about decision making, etc., there's been several articles that have come out lately about mental health crises among college young people. What are some of the pressures that young people face being on their own in college? And you're a veteran senior, so I'm turning to you for that.
Definitely. So I would say one of the biggest mental health pressures that people face is the wanting to be included and being fitted in. So when you're off at college, people have their own ideas about what their freedoms may be or what their interests are. But when they get to college and there's so many different things that are deemed popular based on that specific campus, sometimes people might want to sway their ideas or come up with other solutions. And I think that would definitely be a big pressure. I think a second pressure would be the pressure of your parents. Most people grow up either hearing about college from their parents or hearing about college from their schools. And there's sometimes pressure that they want to do well, especially if their major might not be a passion. That might also cause some anxiety or depression because they've already invested so much money in this specific major, but they're actually realizing in their junior year that that's not what they want to pursue. So I would say between the three of those are some of the biggest pressures that would impact your mental health on a college campus.
Right. And so what advice would you give to sort of, first-time college students on addressing some of these pressures in a college environment? And you can choose from your own experience or other of your peers' experience.
Definitely. Well, I would say the biggest piece of advice is to stay true to yourself and understand that what is for you will not pass you. And once you are willing to accept that, you will be able to be at peace with yourself a lot easier had you not have accepted that. And I think sometimes people don't really understand that because they'll see different organizations or clubs that might be deemed selective and think, well, if I wasn't able to get into this club and I wanted to, then maybe I should change the trajectory of my dreams or change the trajectory of my goals in life. But what you have to understand is every time you are denied from something is not saying that you shouldn't do it. It's just allowing you to understand redirection. And it's allowing you to understand that you didn't need that in order for you to fulfill your life's purpose. And when you are able to understand that and you're able to understand that your failure is simply another opportunity to grow your perseverance and grow your tenacity, I think that it's important for you to understand that you have to keep going even when you might quote unquote fail, because that's only going to lead you closer to what you're supposed to do.
I think people are probably out there saying preach. So Dr. Rochester, as far as mental health resources that college campuses might have for people who are having those kinds of struggles, who might be encountering depression from, breaking up with their first, their first true love that they might meet in college, or some of the other pressures, or facing issues of sexuality, because that's also a time in which young people are defining their own sexuality and understanding it better. What are some of the mental health resources that you would tell parents that they and how to explore it before their child actually goes off to college, so they know what to tell them?
Sure. Before I talk about the resources, I just want to highlight as you mentioned, that, college is actually a time where your child may be diagnosed with a mental health condition. About 75% of all mental health conditions present before the age of 24. So the reality is that those key years during college are often the time when someone may be experiencing their first bout with anxiety or depression, or even something like schizophrenia. And then we have, of course, many teens and young adults who are going into college already with a mental health diagnosis. So in terms of resources, this is one of the many things that parents and their students need to look into, prior to hitting that college campus. We often focus on all of the other things, which are important, but those are the kind of things that you need to look into. What are the mental health services available? Most college campuses have a student health center, and as part of that student health center, most of them have a mental services or a mental health component, but they may have very limited hours, they may have very limited staffing, and there may be certain conditions that they cannot treat. They may only have counseling capabilities, which are important, but if your child is on medication and you need someone to see your child to be able to refill those prescriptions and continue that medication, then your child may actually have to seek care for that condition off campus. And so these are all the things that we should be doing during that summer prior to moving them in. Right now, actually, is a great time to start exploring those various resources. Also, because of COVID, a lot of the schools' mental health services are available online remotely, and that's actually good for some students who may not have wanted to make an appointment or to be seen in the mental health facility for their school. So now, you can do that in the privacy of your dorm or in the privacy of your apartment. And then lastly, there are a lot of apps like Talkspace, where students can access mental health services and particularly therapy services from the convenience of their phone or their tablet.
Great. I think that's a wonderful rundown. And, you also have a guide on your website, 10 things your college student should never leave home without. Can you just maybe give us a teaser of maybe 2 or 3 of those?
Absolutely. Yes. So the guide, as you mentioned, is 10 things every college student should not leave at home. There's the link there for those who want to check it out. And a couple of really important things. One is a health insurance card. Most of our kids are on our plan. Many college students are still on their parents' health insurance plan. And a lot of times the students go off to school. They don't know what health insurance they have. They don't know the policy number. And then they may present to an urgent care center or, God forbid, an emergency room. And the very first thing they're going to be asking after, what's wrong is, we need your identification, we need your health insurance card. And many families get hit with huge medical bills only because the student never presented their health insurance card. And so they were treated as an uninsured patient. So that's one of my tips, is to make sure that your student has their own health insurance card. If not, so in our case, my insurance stopped distributing multiple cards. So my daughter took a picture of it. She has it in a note on her phone. She also has a Xerox copy of it so that she can present that. And then the other thing that most parents and students don't think about is a healthcare power of attorney form. Many of us with aging parents or aging relatives may be familiar with the power of attorney, but we don't often think about that document being important for our student. But the reality is that your student, once they hit that college campus, generally, especially if they're 18 years of age or older, they are considered an adult. And regardless of the fact that you pay that insurance bill, you're paying that tuition bill, if they seek medical care, that information is private. If you call a hospital or even a student health center and you're trying to get information about what's wrong with your child, unless it's an emergency, they will not talk to you. And so the power of attorney form allows you to receive information, and it allows you to make decisions for your child if, God forbid, they are in a situation where they are unable to make those decisions on their own. So those are 2 of the 10 very important things that every college student should have with them.
Well, I think that's excellent advice, and I hope everybody saw that link so that they can go to your website and download it so that they can have a copy of that. I can't believe the time has passed this quickly. It is actually time for us to turn to the audience for some questions. And I'm going to bring in Lila and Wayne again, who are going to get us some questions from the audience.
Well, first I want to jump in and just say great conversation and so much insight from everybody on the panel. We have a statement from Pamela Chapman, who states another resource for mental wellness is the National Alliance on Mental Wellness. So it's www.nami.org. Just wanted to
Great.
share that.
Thank you, Chapman.
Wayne, you have a question?
I'm trying to get the population control comments out. We have another statement. We have a statement from Kathy Sindos. Due to delay in full brain development, parents should be in control of a child until 21. 18 has little justification, she says.
Your thoughts as a pediatrician on that statement, and thanks, Kathy, for that statement / question.
Yeah, as a mom, I totally appreciate what Kathy says. But the law says that, when you are 18, particularly when you're a college student, you are no longer really considered a minor. But that's why these forms and some of this paperwork is important. If as a parent, you do want to continue, and I don't like to use the word control, but as a parent, if you want to continue to have a voice and collaborate with your student, with your child, when it comes to their well-being and their health, then this is the time to complete that paperwork so that both of you have a voice at that table.
Okay.
If I may say one thing.
Yes, I was just going to go to Max. Go ahead.
I have a 17-year-old freshman, and I was told by the registrar, and I was told by the school that even though she's 17, the fact she's in college and she's a freshman, they still look upon her all as if she's almost 18, because once she's in college, to them, the it's been cut. The umbilical cord has been cut, so therefore you probably need to get that document stating that you can get the information from the school itself.
And
I guess that would be akin to emancipated minor, but yeah, that's exactly the case. Thanks for pointing that out. Dr. Rochester?
Yeah.
Yes, I was just going to say, I want to quickly add. So there's the FERPA, which is the educational privacy law. Max is right. When you are a college matriculant, regardless of your age, you are considered an adult in that sense. And that's why parents can't get grades and things like that. HIPAA, which has to do with, the healthcare, there may be some different requirements that take place. But he's absolutely right.
Okay.
Great point, Dr. Rochester. So we have a question from Conchita Mays. Where can one access the healthcare power of attorney form?
That is an excellent question. There's actually a website, and I don't have any affiliation with them, but it's called mamabearlegalforms.com. And they are specifically for, this purpose, for college students traveling abroad. Very user-friendly. I think there is a small fee involved. You can also go to your local hospital. A lot of times they'll have these forms for free. Also, if you go to the court system within your state, you also can find these forms typically for free. And of course, you can have a lawyer draw them up, which will cost, of course.
And there we have it on our screen, mamabearlegalforms.com. And we want to thank our producer, Lala Mays, for her speedy, Lala Mays, for her expedience on that. That's it. So we that's our questions right now.
All right. Well, let's go back to talk a little bit about COVID, because Max brought up some really important issues in terms of what he has been counseling to his daughters. So knowing that there are breakthrough infections, Dr. Rochester, what symptoms should students be watching out for? And when should they consider getting a COVID test?
That's a great question, Dr. Mel. I think that, particularly because it's summer and some people are still experiencing allergy symptoms, a lot of times, students and adults for that matter will chalk up some of the symptoms that they're having and say, oh, I think it's just my allergies. But the reality is if you are having, certainly nasal congestion, coughing, certainly difficulty breathing, but even things like nausea, vomiting, diarrhea, body aches, all of those symptoms that we've been hearing about over the last year and a half, it's always better to err on the side of caution and to go ahead and get a COVID test than to blame it on something else. That way, if it is something else, that's great. You find that out with the COVID test. But, there are some symptoms that overlap with the common cold, that overlap with the flu and even allergies. So I think any type of respiratory symptoms, any, GI, vomiting, diarrhea, or body aches, and certainly fever, then they should definitely be tested.
Absolutely. And now, what about coming back home from from college for the holidays? Even if you're vaccinated, if you have people in your household that you're coming to who are unvaccinated, or people in the house who might have lowered immune systems, such as the very elderly, people with cancers who are undergoing chemotherapy, people on medications like steroids for asthma. What would you tell the college students who are coming back to a household having been away at college for a semester?
Another great question. And this is something that we had to deal with last year in our household prior to vaccination. I think, again, the last thing a college student would want to be responsible for is making someone in their household sick. And so I think that knowing that in college, hopefully they're practicing all the, practice safe practices we've talked about, but knowing that they're going to be around a lot of people, I think the safest thing to do is, if possible, to get tested before they come home, right before they come home. When they come home, I would recommend that they mask when they're indoors in the house and get a second COVID test, again, just to be sure. And then, assuming that there aren't any additional exposures after that second test is negative, then I would say it's probably safe, for them to remove the mask. But when my daughter was coming home for break, she was wearing a mask in the house. And then, she would go get her COVID test and it would come back negative, and then we'd all take our mask off. And so with the variants and, like you said, with people in the household, we have multi-generational households, people who may be more at risk. And so I think that's the safest thing to do, is to mask until you know that you have a negative test.
Okay. We have one more question from Conchita Mays. She asked it early in the night. For those who've had COVID with no underlying health conditions in January, are there still antibodies in July?
That's an excellent question. Dr. Rochester, you want to take that one?
Well, this is something that is still being studied. We definitely know that for at least 6 to 7 months, those antibodies are circulating when you get the vaccine. For people who actually had COVID, there are some people, when they test 2 or 3 months later, they have the antibodies, and then 6 months later, they're gone. There are other people that have tested 8 months later and they still have the antibodies. So, the reality is that everyone is different, and we can't reliably predict how long you're going to have the antibodies in your system. So that's really the primary reason why, even if you've had COVID, we are still recommending that you receive the vaccine.
And I think too, sort of 3 months is the average expected time where they're saying if you had COVID, you can kind of ride on it for 3 months and expect to have protection, but then you should get vaccinated definitely starting once those 3 months are over. And you can get reinfected with the Delta variant if you had the original strain of COVID or some other strain of COVID before. Now, I want to go to Max and Nia because before we got that other question from Conchita Mays, thanks Conchita for that question. I wanted to ask, the recommendations that Dr. Rochester had. I know you all had to manage even before COVID. Do those recommendations sound doable in your household? Because I know you have a multi-generational household and 3 young adults. So Do those recommendations coming home for the holidays sound doable?
As a matter of fact, they do sound doable. I have a freshman in a summer program as we speak, and she's away, and she'll be coming back next week. And this information that you all just spoke about has now opened my eyes, and that might definitely have to be a requirement, even though she has a vaccine, and we trust that she's been following directions. That perhaps we might need to definitely make sure that she has a COVID test before she comes home. So as soon as we get off this show, that will be probably the checks that I'll be doing.
Well, I think the other thing too is no matter how much you reinforce with your child, even if they're 100% trustworthy, they have roommates oftentimes, and you don't know what the roommate has been doing. And as long as they're in the same closed space, they're going to be sharing air and close quarters. So I think that's also very important to keep in mind.
Not to mention that my daughter's in Florida, which is the hotbed.
Well,
Oh boy.
Yes,
There's
that is one of the
Yeah.
states that is having, unfortunately, a surge right now, and where there are lower vaccination rates, which is what's leading to that surge. So,
I have a question for Max and Nia. Max, we'll start with you. What is your biggest health concern with Nia going back to college? And Nia, what is your biggest health concern going back to college?
Well, I guess my biggest concern, is once again going into the dormitory. Well, she's not in the dormitory, but going into the classes. It's going to be big football season. That's opening up. There's going to be a big shindig with kids coming back to school. It's going to be a major reunion, and my goal, hopefully, is that the guard doesn't come down, and they're in these big parties that they go to, and as a result of that, she's going to be mixed in with other people that might not have been vaccinated and get exposed. So that's probably the biggest thing. One of the things that I'm really concerned about.
Okay, so Nia, your question is, what is your biggest concern and what is your commitment to staying healthy?
Yes. So similar to my dad, that is a big concern of mine, because a lot of people, specifically in the Howard community that I've seen on social media, there's a big divide whether people are really for the vaccine or really against it. There's really no median. And a lot of people are planning on lying about getting vaccinated. And I've been seeing that on social media. So people so I just don't really know. Like, I've just seen a lot of people like come up with a lot of fake documents prepared
Wow.
so that they're able to get into those buildings, because a lot of my classes are in person, and a lot of people are very against the vaccine, and there's really no medium. So that is a big concern of mine. But personally, for me, I'm very concerned about Howard's empathy when it comes to mental health throughout this pandemic, because virtual, although it might seem easier and it's physically easier, mentally it's a lot harder because you're kind of isolated, and you're not able to see your friends. And it's also just harder because I'm more of a in-person learner where I can walk to class. Like, walking to class kind of gets my mind right to, okay, I'm about to go to class, versus just, rolling out of bed 2 minutes before. And some teachers I know are going to be in touch, but I hope that Howard will have kind of a universal policy, because they were trying to get like mental health days, like 3 mental health days, each person get that. Especially because in the African American community, we're disproportionately affected by not only mental health issues, but COVID. So they were trying to get that. And that is really a concern of mine, because over this pandemic, I've even been able to be more in touch with my own mental health issues. So I want to make sure that in school, they are empathetic of that, and we're able to get our grades, but also understand that self-care is necessary for great performance.
And I hope the administrators hear that, and also too that students hear what you're saying about the importance of self-care. And unfortunately, I think we are at the top of the hour, and we are going to have to wrap up. I want to thank you guys. This has been a really informative discussion. Nia, Max, Dr. Rochester, you all were fantastic. I think we definitely learned some things that we need to know with our children going off to college, the health insurance card, the healthcare power of attorney, the importance of mental health, the importance of being still cautious about COVID, whether you're vaccinated or not, and the possibility that there will be children who are at college who aren't vaccinated. Based upon what Nia is saying, I definitely believe that is the case. And so the need to keep our guards up, the need to isolate even when we get home after being away at college for a semester, if there are people in the household that we need to protect. All those things are wonderful points that were brought up during this conversation. So thank you so much. I want to go ahead and just remind everybody that I'll be on the Russ Parr Morning Show tomorrow morning at 7:58 a.m. If you can tune in, that would be wonderful. And if I don't see you there or before next Monday, I will be back here next Monday at 9 p.m. Eastern, 6 p.m. Pacific. We have the link right there for you to download the 10 things your college child should not leave home without. And thank you once again to my producers, to my guests, and to you, my wonderful audience, for tuning in. So remember, always be wise, be well, and be health empowered.